Hello, it's Dr. Langford again. I wanted to talk to you about something that I see in the office quite often, and you might be referred to a urologist to look into, and that is blood in the urine. So, what does that mean? It's called hematuria, which also means that there are blood cells in the urine. You can either have gross hematuria, which just means that you can personally see it, or you can look at the urine and see that it's a red color or there's clots, or there is microscopic blood in the urine. And when it's microscopic, oftentimes it's found on an incidental urine test that you have at your doctor's office for yearly labs or for any other screening test. So the key is to figure out one, first of all, if it's visible versus microscopic, and to talk about what the causes might be. So there's a few different things that can cause blood in the urine. So one of the main issues could be that it could be a urinary tract infection, it could be a kidney stone. It could be um, kidney or bladder cancer, which would be very obviously concerning. This is why we screen for blood in the urine. It could be an enlarged prostate. It could also be the result of trauma if you got hit in the side during like a football game or something like that. Or even certain medications can cause blood in the urine, such as blood thinners, aspirin, or certain things that can damage the kidneys. It can also be the result of strenuous exercise. If you're a big bike rider and do this, 15, 20 miles a day, sometimes that can actually cause some blood in the urine as well. So the reason your doctor's going to screen for blood in the urine is to make sure it's none of the more serious causes. Sometimes you can have what's called idiopathic hematuria, where you have blood in the urine and it really means nothing at all. It just means that your kidneys allow some blood cells through. Sometimes it happens in families, and as long as it's not related to any disease condition, we don't worry too much about it. But the importance of evaluating for blood in the urine is to make sure that you don't have any of the big problems. And if you do have any of those problems, that you get them attended to sooner than later. So the evaluation usually involves a urinalysis. We send off a urine culture, and then your primary doctor might actually order a CAT scan. We prefer to have a CAT scan with and without IV contrast because it tells us if there is something concerning or something that's not concerning in the urinary tract. Um, Such as tumors or polyps. And then without the contrast, it helps us to determine if you might have a kidney stone. It's unusual to have a kidney stone without pain. However, if you have them up in the kidney itself, they can be sitting there causing the blood in the urine, but not actually related to pain. So it's always good to make sure of what the problem actually is and the source of the problem or the hematuria is. Now, um, almost always you will have to go to a urologist to have this evaluated for a cystoscopy. A cystoscopy is where we take a tiny little tube. It's about the size of like a phone cord. And sometimes we'll numb up the urethra or we'll actually just take the scope and insert it into the bladder. No incisions are made, but it allows us to look at the inside lining of the bladder. And when we're able to do that, we can determine with pretty good accuracy as to whether or not there are any polyps or tumors. And in a man, we can look at the prostate, and in a woman, we can look at the urethra. In women, I will tell you the most common cause of blood in the urine that I see is that the estrogen levels are extremely low at the urethra. They have atrophy and thinning of the tissues, and it causes some blood in the urine. It also predisposes them to urinary tract infections. We can treat that with a little bit of topical estrogen. For men, the most common cause tends to be that their prostate is enlarged and these blood vessels can get a little bit friable and can cause some blood in the urine. But that being said, the most important thing to know is that if you have blood in your urine and your doctor sends you to a urologist, make sure that you um, discuss with them what you've seen, what your doctor has seen, and follow through with the imaging and the look in the bladder, the cystoscopy, because if you don't, you can't be 100% sure that it's not related to something more serious. And that's, of course, the most important situation is to make sure that it's not related to anything that you'd be worried about. So, that being said, that's the information about blood in the urine. And please like and subscribe and comment below if you have any questions.